All right, thank you for keeping it TV47 and of course Body Garage, where on this episode we are focusing on ear and hearing care, and with me is Dr. Grace Mwangi. Daktari, before the break we had dealt with ear infections, the anatomy of the ear, but also with the ear comes wax. What is its importance?
Okay. I like the fact that you called it wax. You didn't tell me the dirt of the ear.
The dirt.
Because that's a misnomer. And we loosely throw in the term uchafu wa masikio. So the ear also is fashioned to protect itself. And when we say that, you can imagine that we have some glands that are producing this gooey brownish substance that we call wax. So wax is not dirt. It is not dust that entered there. People will always ask, oh, I work in Garissa or wherever. I think it's the uchafu imeingia huko. We all produce wax, and wax has function. Wax is supposed to protect your ear, and it's a lifelong production of it. And what it does is that it's supposed to ensure, even if an insect even tries to get in, since it's sticky, it can prevent that. That's the first thing. Two, it's almost like an emollient, or what we can say like a lubricant along your canal. Do you go oiling your ears?
No.
No. But they're oiled. Why? Because there's also that feeling of emollient inside there. It's also acidic. It has an environment it creates that protects your ears more so from infections. Right? And so, since this is lifelong, you can imagine if you get to 200 or days as Methuselah.
Yes.
It also means that the ear has a fashioned way of trying to clear this wax. Whether it's through chewing, there's also a pattern at which it clears itself. And that's why even if you don't do anything to your ear, if you are to put your finger inside your ear canal, you'll get some sticky substance. Your ear is doing the perfect job. We have a rule in ENT. If your elbow can get into your ear, put anything else in your ear.
Okay.
Your elbow, leave alone mine.
Yeah.
That can still get there. If your elbow, you can be able to twist it and put it in your ear, put in. We give you the mandate to put anything. And when we say that, if your ear has a self-cleaning mechanism, why are we putting biros, Q-tips?
But it's because there's the itchiness.
The cafe and you close your eyes.
And you're like, feels so good.
Horrible. Why? Because first you're getting rid of the excess of what should be there. Right? Two, you can actually push it further in. So people will go and manufacture, it's smaller, it's what and all that, but you can push it further in. Like any other bodily substance, it dries up. And after a period of time, if you're producing more and more and more, and there's a dry wax portion, it accumulates. At one point, what happens? Remember our cave? It gets blocked.
It gets blocked.
And all of a sudden, people come and tell us, I'm in a box.
Yes.
When I speak, I hear myself, people, I can't hear them. Then we tell you, we need to clean your ears, which I almost avoid using the word clean, because clean is all appreciated with that.
Yes. And when you say that, Daktari, before we even get to the cleaning bit, this dirt, because people say it's dirt, why does it lead to that itchiness that sometimes you feel like...
Because too much of it sometimes is not so good. It can give you irritation. And we do respect ears. My ear is not like your ear. It's like a fingerprint. That the caliber of your canal might not be the same. The amount of wax you produce might not be the same as mine. The quality of wax. Some people produce very brownish things and very sticky. And some of them produce very oily and very light. And they can even come and attest and say, I don't have wax. But believe you me, you produce wax. Now the problem is that the minute you get rid of this, you're interfering with that environment. And sometimes you get immaculately clean ears. And I can attest that I tell my patients, I don't like your ear, it's too shiny. Because that's the same patient who's going to tell me, my ears are itchy.
Yes.
Please clean them. I'm like, let me put a camera for you. Let's look at this ear. Shiny canal, shiny eardrum. What are we doing? And sometimes you just have to let it be let the wax come in, and then create that normal environment, right? So you should never ever go probing for it. Basically, wipe the outside, leave the rest. But do we respect that some ears can have wax impaction, which is basically whether due to genetics you produce too much wax, whether God made you to have a nice small canal, but you can hear with it, it still has tendency of getting it blocked. Then we do come in and assist by clearing what is excess. And so we always tell patients, please don't go back doing what? Probing. Why? Because there is really no schedule even for cleaning. Do you understand that? Yeah. Like, you can tell someone, come after 1 month, I clean up your ears. No. It's the minute you have blockage, or it's enough to actually interfere even with your hearing, or to excess, right? And so what does that mean? You can actually go through your life not undergoing this procedure.
Oh, okay. All right. So, Daktari, you mentioned that there are some who produce wax in excess. Why is that?
Genetics.
It's genetics.
So genetics can affect that. There's nothing much you can change. There might be drops out here that are given, but the thing about drops that we give are to soften. It has no impact on whatsoever to reduce on the amount you produce. So the wax drops, and many people will come with them, it's just to soften in preparation for cleaning, right? Or clearing whatever is over there. But it doesn't really say that it stops wax production, which I always say you need wax.
You need wax. Okay. And when you say that, when you put biro pens inside our ears, you're sort of pushing the dirt inside. Is that leading also to the build-up?
Of course. As I said, you push it further in. 2, it dries up. It's like a drainage that you pushed a stone. Just because you can't see it, the stone is still there. So what happens? Any other wax that is forming gets a hindrance. So at one point, you are even prematurely blocking your ear by pushing these things inside. And that's why we tell you, do not put. That doesn't mean because your friend came here and they removed yucky, gooey stuff, everyone comes for syringing. And there's so many times patients will come and we tell them, no, you don't need syringing, or you do need syringing.
And now, what does this cleaning process look like?
It's very cool. You enjoy. You probably swim with all your clothes on.
Really?
It's not painful. Wax is not painful. And basically, you have a controlled pressure. And remember, it's a cave. When there's some substances we can put just to soften it more sometimes if it's too hard. And if we flush, everything comes out. So it's like a conduit. And people see what comes out and they're like...
It comes out from the other ear? Or from...
This ear is different from this ear. 2 different ears. Clean this ear,
and then you clean this other ear.
Clean this ear. Do they need to be both cleaned? Sometimes no. Sometimes it's just one. Sometimes it's both. Sometimes it's none. Yes.
Okay, it's things we watch on TikTok there.
Hallelujah. Now you know that you cannot put a wire on this side and it okay the other side. Yeah.
Okay, and there's a friend of mine who avoids the cleaning process because of, he says, the spatulas that sometimes you use to scoop out the dirt. Why is there, it seems like there's an option where you do not have to use the fluids? So
there's the fluids, which is basically you're applying pressure fluid, which can be just even water that had been sterile and you wash, right? 2, you can actually manually evacuate this thing. Right? When I say manually, when they say the spatulas or these scoops or what, and when you go to YouTube, there are those things. We can use even microscopes, magnify your ear through these lenses, and I can literally use very minute things and come out with them. Those are different ways. I can use suction, basically put it inside there. All those are different interventions of trying to clear it out.
But the cleaning should not be painful.
Never. It should never be. When pain is an issue, there's a problem.
Okay, Daktari. Could you mention to us other habits that, damage the ear?
your headsets, right? The headsets are not a good thing for us. I think let me start with the basics. Ear care just means leave your ears. Wipe the outside, leave the rest, right? And when we say that, the men will go to the barber shops, they have all these interventions that are being done, massage and all that, and things are being done in your ears.
Leave it.
Leave the ear. We go to the supermarket, please leave the earbuds. Walk away, walk away. Wipe the outside. We say the rule is if your elbow can get in your ear, probe it. You have been given all mandate. In other words, leave that ear. If there's pain, if there's reduced hearing, if there is noises, if there's dizziness, see your doctor. Because I told you, those are now things of an unhealthy ear, right? Over and beyond that, noise. Noise is, if the ear is for hearing and you have this excessive noise, you're damaging your inner ear. And remember, we said your inner ear is irreplaceable. Control your sounds. So if you are doing a virtual meeting and you're alone somewhere, why should you use headsets?
Okay, now let's move to a hearing loss. What is it?
Hearing loss is a reduction in the level of hearing. And every year, annually, WHO has created what is known as the World Hearing Day, which is that of March, and it always has a theme. In 2025, we are going to be empowering ourselves because preventative medicine is better than curative medicine. If I tell you what I've told you, at least you know that these ears are not communicating and you'll not buy that cotton bud and you might miss out on a concert. It will have saved me your ear, even if it's a few more years, right? But when it comes to now how we are able to sort out hearing loss, because that's what people are most concerned about. Do you know your child starts hearing as early as in the tummy? And that's why people will put music. They will keep on talking to the child. So some of the things as ENT we advocate for, if you are newborn, even before being born, can hear, can we please ascertain that? And that's why we talk about newborn hearing screening. A child who has just been born, whether preterm or term, cannot tell you whether they're hearing or not. But technology has taught us to be able to do screenings, very quick second screening to tell you, child can hear, child cannot hear. What are the implications of that? Social life, financial well-being, the qualities of this child is totally different. So we are always advocating for newborn screening. Any child who has been born, me, you, we were denied newborn screening, not because we were denied, but also probably our parents were not aware, but every child should be able to be done that, right? So that's newborn screening. Even if it's 1 million children and you pick 20, the life of that group has changed. So newborn screening is one of the things to be able to pick up hearing losses early. Why? Because you can get to be born with a hearing loss, what we say congenital. Whether mommy had an issue in pregnancy, whether during birth, baby got tired, remember the brain is the controller of everything, whether the child was born preterm, all those are very vital things, and you can be able to pick up these issues even before the child starts complaining or you pick up delays. Now, what is the delay? Speech development. Because speech and hearing go in tandem. So most of the times we will see parents bringing in the children because kijana amefika 2 years na vijana wanakuaga slow to the female power.
We are faster.
We are the superpowers. Because they always say the men are a bit the boys. Or COVID came, or social media came, or ni mtoto wa social media. No. But at one point, there's going to be that point where you get a bit jittery. Why is this child at 2 years saying mama, baba only, or nothing, or not responding to sounds, and then there's a yappy child next to them?
Who knows everything.
So that's where we want to pick up early. But things can also go wrong. That you can be born with hearing, God forbid, get an infection, whether ear infection. Remember we said the perforations, that has affected your hearing. Meningitis, it's in the brain, but it's affecting the nerve, gives you a hearing loss. then you can actually be able to assess hearing later, even as an adult, then to find out what is your level and what can we do about it. Yes.
Okay, Daktari, thank you for that. We are up for our second commercial break. When we will be back, we will talk about now the treatment options that are available for some of the ear conditions that do exist. Do not go too far. Keep it TV 47.